Hello everyone, welcome to the video on Target GPAT 2022 MCQ Series. In this video, I am going to explain about pharmacology question and answers with explanation, and this is part 3. Already I have made 2 parts. Now this is my YouTube channel. If you like the video content, do subscribe and share the video. Let's get into the class. Now, antiviral action of purine analogues is primarily related to, most of the antivirals are derived from purine analogues, and the reason why they are purine analogues is because of their structure similarity with the purine, they will be inhibiting DNA polymerase. If DNA polymerase is inhibited, new DNA cannot be formed and viral multiplication is inhibited. So the antiviral action of purine analogues is related to inhibition of DNA polymerase. Now you need to figure out the answer. So what is that? Q is correct, S is incorrect. What is S? Inhibition of viral penetration. No, it is not related to purine analogues, it is related to some other action. So the option B is correct answer. Moving to the next one. Now, which one of the following is tyrosine kinase inhibitor? Tyrosine kinase enzyme is inhibited by imatinib mesylate. It is used to treat cancer. See, all the drugs, these two and this one, 3 drugs are used to treat cancer, but the mechanism tyrosine kinase inhibitor is imatinib. Whereas paclitaxel, docetaxel, plant-related drugs which are used to inhibit cell multiplication. Mitomycin also causes DNA fragmentation. Ezetimibe is a lipid-lowering drug or anti-atherosclerotic drug. How it lowers lipid amount is, ezetimibe inhibits cholesterol reabsorption. Cholesterol reabsorption will be inhibited. Cholesterol absorption from the intestine is inhibited by ezetimibe. So the answer for this tyrosine kinase inhibitor is imatinib mesylate. Moving to the next one. Now, which one of the following is a sign of pregnancy when detected in urine? See, during pregnancy, a particular hormone releases in the urine, and that is what used to identify pregnancy. The pregnancy kits are based on this particular hormone. The hormone is known as human chorionic gonadotropin hormone. The presence of this hormone indicates or confirms pregnancy. Moving to the next one. Increased serum levels of which one of the following is associated with decreased risk of atherosclerosis? See, all these are lipoproteins. Now, lipoproteins, we have one of the lipoprotein is known as good cholesterol. The reason why it is known as good cholesterol is this good cholesterol will remove deposited cholesterol from the blood vessels and takes back to liver. This is what its HDL job is. So what is it doing? It is removing the excess lipids from the blood vessels and taking it back to liver. Hence it is known as good cholesterol. Whereas LDL is known as bad cholesterol. The reason why it is called as bad cholesterol is it causes the lipid deposition in blood vessel. That is what may result in atherosclerosis. So you need to remember 2 things. Bad cholesterol is LDL, good cholesterol is HDL. So the answer for decreased risk of atherosclerosis here is HDL, high density lipoprotein. Moving to the next one. Now, Misoprostal has a cytoprotective action on gastrointestinal mucosa because one of the following actions identify that. Now, Misoprostal and Prostal, all of them are prostaglandin analogues. Now, prostaglandin analogues has a cytoprotective action. What is that? It increases the amount of mucus in the stomach. If this is the stomach, what it does is, it increases the amount of mucus at the walls of this stomach. Now, the purpose of this mucus is, the released HCl will not damage our intestine when the mucus amount is there. Not only that, it also increases bicarbonate too. Bicarbonate may neutralize HCl. So the harmful effects of HCl on intestine are neutralized by prostaglandin analogues like Misoprostol. Now, what is the option here? It enhances secretion of mucus and bicarbonate ion. So this is the answer. So this is the reason why NSAIDs, when taken for a long time, will cause peptic ulcers. Why do they do so? Because NSAIDs inhibit the formation of prostaglandin. If prostaglandins are inhibited, mucus and bicarbonate is inhibited, and that damages our stomach. That is what results in ulcers. So NSAID side effects is related to the function of prostaglandin. What is the function? Enhancing the secretion of mucus and bicarbonate ion. Moving to the next one. Now, metformin causes the following actions except for one. Identify that. Now, metformin belongs to biguanide class. This is a drug used to treat diabetes mellitus. It belongs to a class known as insulin sensitizer. That means the cell sensitivity towards insulin is increased because of these drugs. Now let us see the actions. It reduces hepatic neoglucogenesis. True. Formation of glucose will be reduced by metformin. Now it increases glucose uptake in skeletal muscles. This is also true. Enhances sensitivity to insulin. This is what is meant by insulin sensitizer. So all the three are correct, and the answer is except for one of the following. What is it except? Increases glycosylated hemoglobin by 1 to 2%. No, this is wrong. See, when excess glucose is there in the blood, it combines with hemoglobin and forms a product called as glycosylated hemoglobin. This is what is known as HbA1c. Now this is a measure of amount of glucose for the past 3 to 4 months in the blood. Now the job of these drugs is it will reduce the levels of HbA1c but not increases. So this is not the action of metformin. Moving to the next one. Now, which one of the following statement is false for fluoroquinolones? Fluoroquinolones are very popular urinary tract antiseptics. They have certain qualities are there, features are there. They are highly effective by oral and parenteral use. True. They are relatively more susceptible to the development of resistance. No, it is not. These are effective against those bacteria that are resistant to beta-lactam and aminoglycoside antibiotic. True. When penicillin, cephalosporins or streptomycin are not working, then fluoroquinolones are used. These are bactericidal with broad spectrum of activity. True. So 3 of the statements are true. Only one, the wrong one, is this one. No. These are relatively more, they are not more susceptible to the development of resistance. So the option B is correct. Moving to the next one. Now, corticosteroids are administered to treat some of the given disease states. The options given are peptic ulcer, bronchial asthma, nephrotic syndrome, myasthenia gravis. Let us understand one by one. See, myasthenia gravis is an autoimmune disorder. In order to treat the autoimmune disorder, you need to reduce immunity, and that is possible with the use of corticosteroids. Similarly, bronchial asthma, in bronchial asthma, lung inflammation is there, and that lung inflammation is controlled by using corticosteroids. Even in nephrotic syndrome, corticosteroids are used to control that nephrotic syndrome. The only exception is peptic ulcer. Peptic ulcer is not treated by corticosteroids. So P is not there. In all of these options, we need to find out this one. So P is not. See, QRS are treated with corticosteroids while P is not. So this is the correct answer. Option C is correct. Moving to the next one. Now, following are some opioid analgesics: morphine, pethidine, pentazocine, fentanyl. Choose the correct order of respiratory depressant propensity of these agents. Now, see, when you see the order, they follow a particular order. Out of all these opioid analgesics, fentanyl has got very powerful action. Now, fentanyl is 100 times more potent than morphine. Now, morphine is again more potent than pethidine. Now, pethidine is again more potent than pentazocine. So, this respiratory depressant property is in this order. What is fentanyl option? Fentanyl is S, and then morphine is P, and then pethidine is Q, and then pentazocine is R. So the option SPQR means option D is correct. Moving to the next one. Now, all of the given 4 drugs are neuromuscular blocking agents. Galamine, yes. Vicuronium, yes. Tuberculin, succinylcholine. All of them are neuromuscular blocking agents, but only difference is these 3 PRS belongs to non-competitive neuromuscular blocking agents, whereas succinylcholine is competitive agent. This is the difference in these 4 drugs. Now choose the correct statement about them. P, Q are competitive neuromuscular agents. Q is not, so this is not correct. Now Q and R are competitive. No, Q is competitive, but R, Vicuronium, is non-competitive neuromuscular agent. This is also not true. R and S are non-competitive neuromuscular blocking agents. This is true. In fact, P, R, S, all the 3 are non-competitive. But here, what does it say? The next option, P and S are competitive. No, they are non-competitive. So this is also wrong. So only correct answer is R and S. Now you need to understand this. Except succinylcholine, all are non-competitive neuromuscular agents. Succinylcholine is competitive one. And the right answer is R and S are non-competitive neuromuscular blocking agents. Moving to the next one. Now, all of the given 4 drugs are sympathomimetics. See, adrenaline, isoprenaline, phenylephrine, noradrenaline. All of them are sympathomimetics, but there is a difference. We need to understand the difference. Phenylephrine selectively acts on alpha-1 receptors, whereas noradrenaline will be acting on alpha-1, beta-1, and alpha-2. Whereas adrenaline will be acting on alpha-1, alpha-2, beta-1, and beta-2. Isoprenaline will be acting on beta-1 and beta-2. Now this differentiation is required. The reason is phenylephrine, which is acting only on alpha-1, will increases systolic, diastolic blood pressure. Noradrenaline, which is acting on alpha-1, alpha-2, it also increases systolic and diastolic blood pressure. Now, whereas adrenaline and isoprenaline, they are acting on beta-2 also. Beta-2 agonism will causes vasodilation. Because of this vasodilation, diastolic blood pressure is decreased. This is what is the difference. So any agent with like phenylephrine, noradrenaline, it increases both systolic and diastolic, whereas adrenaline and isoprenaline increases systolic but decreases diastolic blood pressure. Now let us explore the option. See, P and Q, isoprenaline and adrenaline, increases systolic and diastolic. No, what did I say? They decrease diastolic blood pressure. So this option is not correct. Q and R, isoprenaline and phenylephrine, increases systolic and diastolic. No, again, isoprenaline reduces diastolic blood pressure. R and S, phenylephrine and noradrenaline, increase systolic blood pressure. This is true. This is correct. Now again, P and S, adrenaline and noradrenaline, increase systolic and diastolic. No, this is not correct. So this is also wrong. So you need to understand the concept. The moment beta-2 activity is there, they causes vasodilation and diastolic blood pressure is decreased. So right answer is R and S, phenylephrine and noradrenaline increases systolic blood pressure. So this is correct answer. Moving to the next one. Now cetrizine has low sedative potential due to one of the following reasons. Identify that. Now it has high polarity. What happens if high polarity is there? It cannot cross blood-brain barrier. If it cannot cross blood-brain barrier, sedative property is reduced. So the option C is right answer. Moving to the next one. Now deferroxamine is used for the treatment of toxicity caused by one of the following ions. Which one is that? Iron toxicity is treated by deferroxamine, whereas arsenic is treated by dimercaprol. See, all of them are kind of chelating agents, or they form complex, and by this complex the ion toxicity is neutralized and it goes out of the body. Whereas cyanide antidote is amyl nitrate. See, a lot of things are there: amyl nitrate, sodium nitrate, sodium thiosulfate, all of them are used. Whereas lead, EDTA, disodium EDTA, dimercaprol can also be used, and penicillamine can also be used. But here deferroxamine is used to neutralize iron ions. Moving to the next one. Now, following are the phases of clinical trials. Now, let us understand this. See, phase 1 is always human pharmacology. Now, phase 2 is therapeutic exploratory trials. Therapeutics can be explored in this phase, whereas phase 3, the therapeutics can be confirmed, confirmatory trials. Whereas the fourth one is post-marketing surveillance. So, what is the order? First one is P, second one is S, third one is Q, fourth one is R. PSQR. PSQR. This one is answer. PSQR. Moving to the next one. Now, what is the mechanism of aprotinin? See, you need to know about this aprotinin. Aprotinin is derived from bovine intestine. It is known as bovine pancreatic trypsin inhibitor. It inhibits many proteases. So, aprotinin mechanism is it inhibits many proteases. One of the major proteases is plasmin. Now, what is the function of plasmin? Plasmin converts, in fact, it degrades fibrin, degraded products. So, when fibrin is degraded, coagulation is inhibited. So, aprotinin is used to treat bleeding disorders. It is used to reduce bleeding. Why? It inhibits plasmin, so fibrin is not degraded, coagulation clot is still remains there. So, what is the option here? Inhibits plasmin, which is also used to treat bleeding disorders. Inhibits plasmin. Moving to the next one. Now, identify GABA reuptake inhibitor. Now, GABA reuptake inhibitor is tiagabine. Now, see, everyone has got a function. Progabide is GABA agonist. Now, bicuculline, in fact, it is an inverse agonist which also acts as GABA antagonist. GABA antagonist or inverse agonist. Whereas baclofen increases GABA release. So out of all of them, the one which acts as GABA reuptake inhibitor is thiagabine. Moving to the next one. See, the increase in concentration of second messengers leads to, see, when second messenger concentration are increased, they increase intracellular protein kinases and causes protein phosphorylation. Kinase is an enzyme which attaches phosphate group and that results in phosphorylation. So the answer is, I'm sorry, this is inhibition. No, protein kinases activation and protein phosphorylation. See, you need to be careful with choosing these answers. So be careful. So the option is protein kinase activation and protein phosphorylation, not inhibition. If it is activation, that is true, but option is this one, option B. Moving to the next one. Now, cholinomimetic that activates both muscarinic and nicotinic receptor. See, this is a tricky one. The answer is carbachol. You know, bethanechol has got reduced nicotinic receptor activity, whereas carbachol is not like that. Lobeline has got only activity against nicotine. Pilocarpine only effective against muscarine. Both muscarinic and receptor, the option is carbachol. Carbachol is the right answer. Moving to the next one. Now, adverse effects of Cerivastatin. See, all statins are HMG-CoA reductase inhibitors. Their major side effect is high risk of rhabdomyolysis. Myo means muscle, lysis means breakdown. Rhabdo means striated muscles or skeletal muscle breakdown. So all statins, the major side effect is rhabdomyolysis. Now, which of the following is interleukin antagonist? Anakinra is interleukin antagonist. Whereas aldesleukin, see, everything has got a particular use. Aldesleukin is a modified human interleukin 2. It is a modified human interleukin 2. Whereas rituximab is a monoclonal antibody which is used to treat cancer. Etanercept is tumor necrosis factor alpha inhibitor. Tumor necrosis factor alpha inhibitor. So these are all the set of 20 questions which are given in previous GPAT examination. If you like the video, do subscribe and share the video. Thank you for watching this video.